lecture session, and the speaker will be Dr.Ananda Balayogi Bhavanani sir. To speak on the topic is traditional and modern perspectives in yoga therapy. And the moderator would be Miss Anandhi, Mary Cecil madam. So I would request ma'am and sir to come on stage and take their seats.
Namaste everyone. Start with a small invocation. Start.
Sahana bhavatu, Sahano bhunaktu, Sahaviryam karvavahai, Tejasvinavadhitamastu, Ma vidvishavahai. Om Shanti, Shanti, Shanti. Om Shri Gurubhyo Namaha Hari Om.
We are blessed to be in the presence of an extraordinary thought leader whose work has touched lives across continents. Let me take this opportunity to introduce the esteemed speaker of the day, my beloved Guruji, Dr.Ananda Balayogi Bhavanani, an eminent Indian Yogacharya and authority on integrative medicine, serves as the director and professor of the Institute of Salutogenesis and Complementary Medicine, ISM, at Sri Balaji Vidya University, Pondicherry. He is the residential Acharya at the International Center for Yoga Education and Research, ICYER, a gold medalist medical doctor, a prolific researcher, a Rishi Putra, proudly carrying the lineage of his illustrious parent, an Indian classical singer, choreographer, mridangam player, and most importantly, a spiritual practitioner. His work bridges ancient yogic wisdom with modern medical science. My philosopher, my guide, my guru in true sense. So blessed to have you with us today. Over to you.
Offering programs ranging from postgraduate certificates and diplomas up to the master's level training and even PhDs in yoga therapy and music therapy. ISCM is unique and may be the only institute in the whole world where yoga therapy and music therapy have been integrated within a modern medical institution. Yoga therapy and music therapy are offered to all the care seekers in our healthcare institution and all the students of medical, dental, nursing, paramedical, allied health, physiotherapy are receiving training in yoga and music therapy. Do join us for an amazing journey of learning where you will become one of the brand ambassadors of yoga therapy and music therapy as part of traditional, complementary and integrative medicine. Thank you so much Anandhi, Mary, Cecil for that kind introduction, and thank you so much for having me back again this year. I have fond memories from my last visit last year just prior to Durga Puja, and once again I am here just prior to Durga Puja. So today I am going to focus on a few very important concepts that link traditional yoga therapy with modern science. Because most of us in this hall are either students or teachers or authorities in the modern medical understanding. I wanted to take this forward and I wanted to share some of the thoughts on this whole concept. But before I go into that, the first and foremost aspect is to introduce why I'm here, that is salitogenesis. And salitogenesis basically looks at all the factors that enable us to be healthy and have a sense of wellness and well-being. It contrasts with pathogenesis that focuses on disease causative factors. So the first point we need to think is, if my blood pressure is normal, if my blood sugar is normal, if I don't have a microbial infection, does it mean I'm healthy? And the answer is actually no. Because health goes beyond diagnosis, health goes beyond classification. It is a sense of ease within. So here, in salitogenesis, the founder of salitogenesis, Antonovsky, has given us this very beautiful concept where you all have a stressor. Now everybody has stress, there's nobody who doesn't have stress. When the stress comes into our system, it creates a tension, and that tension can be dealt with in two ways. If you have the resistance factors, well, you can go on to the health side, but if you don't have it, you go down the pathogenic pathway. So the same stress that can make you sick can enable you to be healthy. So don't blame the stress, blame yourself and your response to the stress. How do you respond to the stressor? Do you say it's going to kill me, or do you feel it's going to make me a better version of myself? That is how the whole change occurs. And this is why I suggest a change in paradigm from the medical professionals asking a question, what did I do today to prevent illness or treat illness, to what did I do today to create health and wellness. Today's topic is looking at yoga therapy, the traditional and modern understanding. And Rudyard Kipling made a beautiful statement long ago, so long ago, we don't know how long ago, that east is east and west is west and never the twain shall meet. However, with apologies to Kipling, even his famous character Mowgli is now doing yoga. So we can see that, well, there's been a huge linkage happening in recent times, and especially if you look at the mind-body therapies, lifestyle modification therapies, we find that happening. So this east-west dichotomy has been balanced by these mind-body therapies, and if you look at yoga, it is all about integration. Yoga looks at the whole person rather than just the body or the systems or the organs. And if you look at yoga therapy today, just before I came a couple of days ago, we have about 9,536 papers in PubMed, which is still the gold standard despite Scopus trying to do a lot of stuff. The results for yoga therapy showing more and more work happening in yoga therapy. So what is yoga therapy? Yoga therapy is nesting inside the larger concept of yoga. So yoga therapy is neither separate nor greater than yoga itself. That is the first understanding that we would like to have. And how do we define yoga therapy? The International Association of Yoga Therapists, which is the professional body for the worldwide understanding, talks about yoga therapy as a professional application of the principles and practices of yoga. It is not just the techniques of yoga, but the principles that include psychological, physiological, philosophical and spiritual concepts in a therapeutic relationship to promote health and well-being. We are not just looking at disease mitigation, but inducing health and wellness in each individual. Yeah. So a lot of very good standard textbooks have come up. You can Google them and you can get them. I'm not going to spend too much time on each one. But I would like to stress on the one on the top, the Principles and Practice of Yoga and Healthcare, which is a standard medical text with amazing contributions by authorities worldwide that has clear-cut, evidence-based approach for yoga as a therapy. The Indian Yoga Association is ensuring that the standard of yoga therapy of India will be the platinum standard for the world through continuous education programs with all our leaders. Now let's come to the term healing. What is healing? Healing is restoration of the wholesomeness that has been lost by disease. When you have illness, you fall into pieces, you are fragmented. So the defragmentation you do on your computer drive, doing the defragmentation, once again becoming wholesome, is actually the goal of yoga and yoga therapy. And it is not only the biological or the biomedical approach, it is the biological, it is the psychological, it is the sociological, and never, never, never underestimate the spiritual aspect of health and healing. And all of these aspects, we can see that yoga therapy is having much more evidence being shown these days through rigorous trials. So when we talk about these concepts, we have tradition on one side, we have the modernity on the other. How do they come together? Let's start with the definition of health by WHO. And we all know physical, mental, social, and spiritual well-being. Now this is something that long ago Maharishi Patanjali, about 2500 years ago, has given the Ashtanga Yoga system, where the Yama Niyama, the first two Angas, deal with social health, the Asana Pranayama with the physiological health, you have the mental health through Pratyahara Dharana, and spiritual health, Dhyana Samadhi. Now spiritual health is something that modern medical science is understanding but not able to directly deal with. This is where these type of systems are useful. We have a concept of the 5-layered existence. Now these layers of existence are not just hypothetical. I can see all of you sitting here, you can see me standing here, which means we all have a physical existence. That physical existence is our anatomical existence. Now every cell has a physical existence. You can look at it under a microscope. But then is the cell only a structure that you draw in your exam sheet? No, it is not that. It is something that is functional. That functionality of the cell is called the pranamaya kosha because it starts to have a physiological existence where it has functionality. But it doesn't stop with functionality. Every cell knows what it is to do. A kidney cell will only do the work a nephron is meant to do. A neuron will do its job and not the job of a nephron. And a nephron cannot do the job of a liver cell. Each cell knows what to do, that is its manomaya kosha. And it knows how much to do, how much not to do. So there is an intelligent feedback system within each cell so that it can secrete in the appropriate manner for homeostatic well-being and not go into an allostatic load that then leads to disease. That is the Vijnanamaya, and every cell in your body, those trillions of cells, is connected to each other cell. Well, all of your cells know that they belong to you. And if they think they don't belong to you, you have autoimmune disorders. So the cells knowing that we are all part of this whole person. In fact, I like to joke that your cells think that you are God. For your cells, you are God, and then there are some cells singing bhajans to you, believing in you, some cells denying your existence also. Another concept from psychology that ties into this concept in yoga is of the flow experience. The flow experience is when you are doing something so well, so skillfully, with such a challenge that you lose yourself. You are doing it, but you are not there anymore. It is just happening. And this, in the Bhagavad Gita, which is a yoga shastra, it is understood as the concept of yoga karma sukhaushalam. And this is beautifully brought out, that when you can manifest skill, dexterity, excellence in your action, and your action is without expectation, at that point you can go into this experience of flow. You could be teaching, you could be performing, you could be cooking, you could be just sitting there and have that flow experience. Another concept that we have in yoga, which is again very much in tune with modern medical understanding, is the concept of autonomic balance. We call it sympatho-vagal balance. Sympathetic, as you know, is fight and flight. Parasympathetic is rest and digest. And you want a balance. You neither want sympathetic dominance nor do you want parasympathetic dominance. You want balance. And for that balance to happen, you can see when you can educe what is called the relaxation response, you can start to heal the individual. If you are stressed, you will not heal. And so if you have a patient who is saying, I want to get better, 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 they'll never get better. Because if you are stressed about getting better, you'll never get better. When you say, I have done my best, let me relax. When you relax, your vasculature will relax and automatically your tissue perfusion will be enhanced. Tissue perfusion is enhanced, your healing metabolites will come into play, you will heal faster. What will take somebody 2 weeks can be done in 1 week if you facilitate relaxation response. So, relaxation response is proportional directly to the healing response and inversely proportional to the stress response. This is one of the most important contributions because if you don't relax, you cannot heal. So people talk about how can yoga contribute to modern medical healthcare. I think the best way is a non-drug, non-pharmacological method of self-educed relaxation. Because if you want to relax and you use a pharmacological drug, you know what will happen. One, you will become dependent on that drug. Second is tolerance will develop and over time addiction will come. We know what has happened in North America with the opioid crisis. Because people have not learned to relax, they have not learned to educe the healing response, they have become dependent on the opioids. Another concept which is something which you will all enjoy is the concept of the sinus arrhythmia. Now in physiology, you know very well that when you breathe in, the sympathetic system is aroused. So your heart rate will start to go a little faster. So it starts to go whoop, dup, dup, dup. As you see on those monitors, you know those monitors, especially in movies they show those monitors. And for those of you who have seen them, you know how terrifying it can be when the monitor starts to go beep, 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 beep. You know some emergency is happening. You don't want that beep, beep. So what happens is when you breathe in, the sympathetic system comes into play, the heart rate goes faster. When you breathe out, what happens? Parasympathetic comes into play and the heart rate goes slower. So as you are breathing, what will happen? Beep, 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 beep. As you breathe out, beep, 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 beep. Then next round, beep, 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 beep. So which phase of respiration do you think we should prolong? Inspiration or expiration? Can I have some answer? Inspiration or expiration? Which should be prolonged? Expiration. I think it's written there, right? See, even after giving it in writing, you are not knowing how to copy an exam. See, this is an important skill. All teachers want to help the students to pass. Please understand that. We keep on giving clues. And the clue is right there. What are we doing in pranayama? We prolong exhalation. When you prolong exhalation, you breathe in for 4. Breathe in, 2, 3, 4. You breathe out, 2, 3, 4, 5, 6, 7, 8. And suddenly what happens? You enhance the vagal tone. Automatically what happens? Your heart rate starts to slow down. Why should you slow down the heart rate? Well, that is where we come into the next part, the cardiac cycle. Now in the cardiac cycle, if you look at the cardiac cycle, let's take the ventricle. Traditionally we say, if your heart rate is beating 75 times per minute, 60 seconds divided by 75 is 0.8 is your cardiac cycle. 0.3 is systole, 0.5 is diastole. Now, this systole part cannot be changed much. The heart says, I need 0.3 to supply blood to the whole body. So what happens is, the faster your heart goes, the less time you have for diastole.
Now diastole is the time where the heart is getting all the blood. It says get the blood and then pump out. Get the blood, pump out. Now what happens if you shorten this? The heart is not getting enough blood and is having to pump. So it is working more, but what is the outcome? Less. You are working double, triple, but you are achieving less. So what is happening? Efficiency, cardio, pulmonary efficiency goes down, which is why if you breathe and you breathe out for a longer period, you slow down the heart rate, you enhance cardiopulmonary efficiency. Another very important thing, the heart supplies the whole body in systole. Okay, the whole body is supplied in systole. When does it supply itself? You know your cardiac muscles, those myocardial muscles, they are only supplied in diastole. The heart is supplying everybody in systole, only in diastole it supplies itself. Now what did I say? If your heart rate starts to go faster and faster and faster and faster, you are sacrificing diastole, you are sacrificing your own cardio health. And this is why pranayama is not some magic formula, it is very practical. The moment you slow down the breathing, the moment you start to prolong the exhalation, and you can prolong the exhalation by using the sound. For example, humming in Brahmari Pranayama. This morning from my hotel I made a Instagram post on Brahmari. Very simple. You breathe in and you breathe out with a humming sound. So now I have prolonged my exhalation. Do you want to try this? Let's all breathe in. Let's breathe out. Hey, I'm giving you an opportunity to make noise, okay? And you don't want to make noise? Come on, healthy noise. Come on, let's breathe in. Let's breathe out. It's very easy to breathe out for a long time if you're humming. When you hum, you can breathe out for a longer time. What is happening? You're slowing down the heart rate. You are enhancing your cardiac and cardiopulmonary efficiency. Automatically, what is happening? Your heart is getting better blood supply to its own muscles. Your heart is becoming happy, okay? A happy and healthy heart. And you know what? Nitric oxide. When you hum like this, nitric oxide, endogenous nitric oxide is secreted, and that is another vasodilator. So if you have hypertension, your diastolic pressure will go down because the peripheral resistance will go down. Automatically, your tissue perfusion is enhanced. Simple humming. Let's hum once more. And I want to hear all of you. Can we do it? Let's breathe in. Let's breathe out. The moment you do this, you become calm. And again, you know one more thing, humming will suppress your limbic system. Your limbic system is this emotional volatility. Hey, what's happening? Who's doing that? That's the limbic system. Okay? That's what the limbic system does. The moment you go, what happens is the limbic system is being told, go to sleep, slow down, don't be overexcited. Because if the limbic system is suppressed, is brought down, your prefrontal cortex will start to work. And what enables you to make rational, proper choices? Let's put our hand here, okay? Prefrontal cortex, let's chant with me, come on. Come on, let's all chant. Prefrontal cortex, prefrontal cortex, prefrontal cortex. This is the part that makes you human being, okay? The rest of your brain is like any rat. That's why we can do rat studies and equate with human beings. You can do rabbit studies, rat studies, and monkey studies, and equate with human being. But you cannot give them the power of choice. The power of choice is the superpower of being human. Only you as a human being, me, us as a human being, has the power to make the choice. And I don't mean choosing whether you want vada pav or pav bhaji. I'm not talking about that choice. I'm talking of the choice of doing the right thing because it is the right thing to do. Shreya Marga, as Yama tells Nachiketa in Kathopanishad. Similarly, with our breathing, in yogic breathing, we work on the front, side, back of the low chest, front, side, back of the mid chest, front, side, back of the upper chest, and these are nothing but what today we call bronchopulmonary segments. And you have bronchopulmonary segments and the breath into this. The mindful breath, yado mana tata prana, where the mind goes, the prana flows, can be enhanced also. And that is what you can see here, the energies. When you are breathing properly in yoga, breathe in and circulate the energy from the bottom to the mid to the upper part, on right and left. You are working with what the yogis call Ida and Pingala Nadis. Those are the subtle energies that you can enhance through the breathing. Similarly, we have the 5 pranas. We have what is called prana in the heart region. It enhances respiration. We have apana in the pelvic region, which helps us eliminate. So if you are having an issue with evacuation, elimination, menstrual disturbance, it is the apana vayu. So each of these can be worked on so that we can have what I call a yogic diagnosis and work with it efficiently. One of the most important ways that yoga as a therapy can be understood in a modern framework is psychoneuroimmunology, psychoneuroendocrinology, where we can see that when stress comes in, it aggravates. The yogis call this the chakra system. What are the chakras? Well, they are nothing but Einstein's formula E is equal to mc square. They are the mass. You have the gonads, you have the nerves, you have the physical structures which are mass. When you use your mind and contemplate them, you are energizing them and you are attuning to what is called the chakric energy, which is a state of wellness. Yes. So you put stress into this psychoneuroimmune system, what happens? Red is for danger. Nervous system, endocrine, immune, you are going to end up retarding the healing and delay rehabilitation. Now you put yoga into it, it's going to have the opposite. Because where does it all come in? It comes into the cortical association areas where you perceive the stimulus. If you don't perceive something as being stressful, it will never stress you. And you change your attitude. And this is why in yoga we say it starts with the manomaya kosha, it starts with the adi, what is called psychosomatic disorders. Becomes the vyadi, going through the psychic phase where you are not at ease with yourself. Psychosomatic, temporary raise of blood pressure and blood sugar and muscular cramps and all of that, but then it becomes permanent and somatic. And if you still do not take care of yourself, remember the heart supplying everybody and not supplying itself. If you don't take care of yourself, you will be of no use to anybody. If you are dead, you are of no use to anybody. So better be healthy. To be healthy, you have to make the right choice. And that is why my beloved mentor Selvamurthy sir, one of the most eminent scientists of India, said yoga works by modifying the perception of stress. The second is it optimizes our response to stress. And the third, efficiently release the stress. You know, if you have stress, you are holding on to the stress. What do you need to do? You need to throw it out. And that is why throwing out the stress is a very important way to deal with it. And this is where I go back to Antonovsky. The stressor comes in, creates a tension. Are you going to let it kill you? Or are you going to use it to become a better you? That is where yoga comes in. Can we all stand up for one moment? I'll show you what you can do for it. You have been sitting for a long time. Let's all stand up. Come on, just move your legs, okay? Let's shake our right hand. Give a nice shake to the right hand. Right. Now let's shake the left, shake the left, shake the left. Shake both hands. Nice shake, as fast as possible. Shake. Up, down, right side, left side. Give a nice shake. Now catch hold of all the stress. Whatever stress you can catch hold. Take in a deep breath. And now we throw it out. It's still stuck on your fingers. Your fingers are showing a lot of stress. Let's shake them again. Shake up, shake. To the right, to the left, down. You can make it like this. shake. Hold the stress. Hold it tight. Take in a deep breath. And throw it out. Now you sit down. See, you will have no stress. All of you were like, you were looking like you were dead, okay? And now you have come alive. Whenever you have stress, please understand, whenever you have stress, if you hold on to that stress, it will give you a gift. Diwali gift. What is the Diwali gift stress gives you? Disease. The Diwali gift stress gives you is disease. So if you hold on to stress, I can write it now and give you your kundali that you will have disease soon. So what do you need to do? Let go. That letting go, see, this is why you have to give. If you want, I want, you are getting, holding on to it, let go. The more junk you put into your food, the more junk you will become. If you eat junk food, you become a junkyard. If you think junk thoughts, you become a junkyard. If you speak junk, you become junkyard. You make the choice. Do you want to be a junkyard or not? It's your choice, not for somebody else. So stress comes in negatively. Yoga enhances healing and facilitates the same pathway. Nervous system, endocrine system, immune system. Pathway is the same. Stress leads to disease. You put yoga in, it is the antidote to stress. It is the vaccine against stress. And that is why we want to regain the psychophysiological balance, deal with the root cause. And as Bhagavad Gita says, dukkha samyoga viyogam yoga sangitam. You want to disconnect from your attachment with suffering. My disease, my problem. As long as you say it is your problem, you will never solve it. Stop calling it my problem, say the problem. The moment you say the problem, it is an unwelcome visitor who you can kick out of your house. In yoga, we look at 12 different points of diagnosis so that we can have a yogic assessment to go with the medical diagnosis. And true yoga therapy is a bridge where the ancient holistic wisdom and modern scientific understanding meet for the welfare of humanity. We need to focus on wholesomeness, focus on salitogenesis, move from dukkha, suffering, to sukha, which is ease and health. And thanking you on behalf of our beautiful team at the Institute of Salitogenesis and Complementary Medicine. And I think that's a good place to stop with a comment from my beloved father and guru, Swami Geetananda Giri, who said, your health and happiness are your birthright. Learn and live yoga, for then you will know true health and happiness. He also made a beautiful comment. He said, if you want to be happy, do happy things. If you want to be healthy, do healthy things. That is the power of choice. And thank you for giving me this opportunity to be back with all of you. Thank you.
I want to sum it up all by saying, if you want to be happy, do happy things. If you want to be healthy, do healthy things. From pieces that we are to a space of peace. I think I can take 2-3 more minutes. If there is any question, 2 questions I'll take up quickly. Anybody? I have some of my yoga students I can see. Any question for Guruji?
Namaskaram, Guruji. There was a mention of Maha breathing and the Mahat breathing. Could you please elaborate on that?
Yeah. You see, actually what happened is, normally we human beings are breathing about 10% of our capacity. So we should be able to breathe between about 3,500 to 4,500 should be our breath capacity, what is called vital capacity. However, most people are very satisfied with about 300-350 milliliters as a tidal volume. We are breathing 10% of our capacity and we seem very happy about it. Now, if students come 10% of classes, I don't think our teachers will be happy. If teachers give students 10% of the marks, I don't think students will be happy. And if all of you are only 10% of the time in college, management will not be happy. But 10% of breathing, we seem very happy. So what yoga is saying is the yogic approach to breath is learn to mindfully breathe into the low part, the middle part and the upper part, and understand, as I said, the bronchopulmonary segment. So breathe into the front low, side low, back low. Front mid, side mid, back mid. Front upper, side upper, back upper. So when I sequentially use the mind to guide the flow of the breath, yato mana tata prana, where the mind goes, the prana will flow. I am guiding myself to optimize the efficiency of my breath capacity. The moment you do this, it is called Mahat Yoga Pranayama. Mahat meaning the grand, yoga unification. The pranayama, which is not breathing exercise, pranayama is a methodology to enhance your experience of life force, prana, through the breath. When you do this, you will start to breathe at your best. If you breathe at your best, every cell in your body is going to go, Jai Ho! Like that they will do. Huh? That's what will happen. Thank you. The cells will say, how's the Josh? Okay?
I think we should go for a loud Jai Ho, everyone, students. Yes? All together, come on. Jai Ho! Jai Ho! Once more.
You're still sleeping.
Louder. Louder. Yes. Lovely. One more question. Please come on.
Thank you, sir. Sir, I have seen that in last slide that three guna. Sir, what is three guna? It any helps in our preventing any health condition?
Yeah, you see what happens is we have the tamasika guna, which is dull inertia, dullness. We have the rajasika, which is hyperactivity, and sattvika guna, which is balance. Now, if you want to be healthy, you need balance. Physiological balance is called homeostasis. Psychological balance is called equanimity, and in yoga we say samatvam yoga uchyate. Siddhya asiddhayo samabhutva samatvam yoga uchyate, says Lord Krishna. So here, when we are evaluating the individual who comes to me, I am not just looking with a diagnosis, you are diabetic, you are hypertensive. In fact, I never give a label to people. I want to look at that individual who has come to me and understand, are they manifesting a lot of dullness and laziness that is preventing them from leading a healthy lifestyle? If they are doing that, I have to find methodologies in yoga to wake them up. Now somebody is very active, overactive, so that overactivity leads to stress. I need to slow them down and calm them down. And if I find somebody who's balanced, I have to keep them balanced. Now I'll tell you one small secret, don't tell anybody. You never find people who are balanced, because everybody is imbalanced. So most of the time it is tamasika and rajasika predominance, and this is an important guideline on what type of yoga practice you should give. It is not the same practice for everyone, because each individual is unique. Today we call it pharmacogenomics. We want to look at how we can target the drug for that individual. That is what the Indian knowledge system said. Each individual is unique. And I'll end with William Osler's statement. William Osler is considered the father of modern medicine. We have forgotten him totally. William Osler said, the good physician treats the disease. The great physician treats the person who has the disease. When we are looking at the person-centric approach, it is a humanistic approach. And the humanistic approach is the only approach where we can value, love, and respect other people as a human being, and then humanity will grow, and automatically health, happiness, abundance, prosperity, joy, well, it will all manifest. Thank you.
Thank you so much, beloved Guruji, Dr. Anand Balayogi Bhavanani ji. A big thank you to my beloved principal, SNB sir, for always standing behind me, behind my department. A big round of applause for SNB sir, everyone. I don't think without your support and support of NSHM Knowledge Campus, everyone else, we would have been able to do what we did today. A big thank you to my department, my beautiful students, and all the students at NSHM. Thank you so much. Have a wonderful day ahead. Namaste.
We'll take 2 minutes, ma'am.
Yes.
So thank you, sir. As usual, your session has been interesting, energetic, and we are, I think, spread of happiness is always there from your side. Last year also and this year also. So now I would request Mary Madam to felicitate. Give us a big round of applause for Bhavanani, sir. Applause for ma'am as well.